Much for your time today. Now, if you will remember, when AstraZeneca was about to land on South African soil, there was really a lot of fanfare around its arrival. A very different approach that we're seeing now. Why is it that we're talking to you as Bhekisisa, the Centre for Health Journalism, as opposed to the Department of Health, who so far have spearheaded communication around the vaccine and its arrival?
Well, I suppose I can't answer for the health department. I think you would have to ask them. But you are right that there is certainly less fanfare and also fewer details around the time of arrival. We don't yet know, will the minister go and receive the vaccines at the airport or not? All we know is that they will arrive today, weather permitting, and all of those things. But the good news is that we know that the Johnson & Johnson vaccine is effective against severe disease that is caused by the new variant in South Africa. It provides 85% protection against severe disease. And the reason we really want to know about severe disease is because that's the type of COVID that leads to hospitalization and death. We also know that it does offer protection against less severe forms of COVID. It offers about 57% protection against severe to moderate disease. So it's not as good as against severe disease, but we really do want to prevent deaths and hospitalizations, which is why the protection against severe disease is so important. And if we compare it to AstraZeneca, we know that AstraZeneca only provides 10% of protection for mild to moderate COVID disease caused by the new variant. And we don't yet have data. We don't know if it protects well against severe disease or not.
Talk us through the journey that the Johnson & Johnson vaccine will travel upon arrival in South Africa. We know that AstraZeneca had to go through some tests before actually administration. What is the journey going to be for Johnson & Johnson?
So the kind of process that this batch of Johnson & Johnson vaccines will go through is different from the process that the AstraZeneca vaccines went through. And the reason for that is that these vaccines will be used in a research setting, and the AstraZeneca vaccines were going to be used in a wider rollout. So before we can use vaccines in the countries, they need to be approved by SAHPRA, our medicine regulator. Now, the kind of approval that AstraZeneca had to get was for wider rollout, and the kind of approval that the Johnson & Johnson batch this time around got is for use in a research setting. That kind of approval happens much quicker, within a few days. The approval was given on Friday, and the Johnson & Johnson vaccine still needs to get that type of approval that the AstraZeneca vaccine got. And that could take us up to another 2 months because there's lots of data that SAHPRA still needs to review. So the reason we brought it into the country as part of a research trial is because that is the only way that we can get it into the country immediately and get it to health workers as quickly as possible, as opposed, it's basically a way that we help health workers while we're still waiting for the wider approval. And that is why this batch of Johnson & Johnson vaccines doesn't have to be sent to Bloemfontein to undergo the same tests that AstraZeneca did, because it's in a research setting. But when it comes into the country for wider use, it will also go for those tests.
Talk to us, Mia, about the number of batches of the Johnson & Johnson vaccine that we will be receiving and what the timeframes are for that. We're only going to be receiving 80,000, vaccines. How many people is that actually going to cover?
Well, you're absolutely right. It's not nearly as many as 1.5 million, right? That the AstraZeneca vaccine batch is that we have bought. We have only received 1 million so far. But we are going to get a total of 4 batches every 2 weeks. So we're going to get 3 batches of 80,000 vaccines arriving every 2 weeks from now on. The first one, obviously, today. And after that, we will get a batch of 60,000. And then Johnson & Johnson will look at whether we were able to use all the vaccines. That is a total of 300,000. And if they're satisfied with the way that we've administered it, they will give us another 200,000 vaccines. And that makes for a total of 500,000. Now, important to note, these are vaccines that we will get for free, and Johnson & Johnson is giving it to us from research stock that they haven't used for trials. So in addition to that, South Africa has also procured 9 million of the Johnson & Johnson vaccines. And for those, we will have to pay. And for those, we will need approval for wider use. We won't be able to bring them in under research use. And there's also talk of 20 million more, but we haven't had official confirmation on those 20 million. When will we get them? Well, it all depends on when Johnson & Johnson will have stock. They are struggling to produce stock. All the vaccine manufacturers are struggling with keeping up with production. And secondly, it depends on when the SAHPRA approval will come through. Because even if Johnson & Johnson has stock, we still can't use those vaccines unless approval has come through.
Traditionally, how long would it take for a SAHPRA approval to come through?
So one of the trial's co-investigators, Glenda Gray, who's also the president of the South African Medical Research Council, has told Bhekisisa it will take about 2 to 3 months for the approval. Something that complicates this process at the moment is there's a process that SAHPRA uses during the pandemic to speed up the approvals, and that is called a reliance mechanism. And the reliance mechanism is something that they use to rely heavily on the findings of other large regulators. For instance, the Food and Drug Administration in the United States or the European Medicine Agency. But in the case of the Johnson & Johnson vaccine, no other regulator has approved it yet because Johnson & Johnson is a new vaccine. Its results only came out a while ago, long after the AstraZeneca results, for instance. So we don't have that data at the moment. We know that the FDA in the US has scheduled a meeting for the 26th of February to look at approval and to have an independent review committee meet about it. And once that data has come through, it will be helpful to South Africa. But we need to wait until SAHPRA has also done its own reviews, although the FDA's decisions and reviews would help us to speed up the process. 2 to 3 months ago, into Glenda Gray. So we're looking at March, April.
It's a long time for the testing, but one has to acknowledge the fact that it's a necessary process and a necessary step of the process. But the 80,000 that we've received now, how are they going to be distributed? Which hospitals and when will healthcare workers actually start being vaccinated?
So the health department has identified 17 sites across the country. There are 2 in each province, except for the Northern Cape that only has 1 site. And those sites are all public hospitals. And how do we know how many vaccines each site will get? They have released a list, but they use the following things as criteria, 2 things, and it is what is the burden of disease in the area where the hospital is situated? So how many infections are there? How bad is COVID there? And secondly, how many health workers do they have? And they've calculated the amounts, accordingly. And according to another co-investigator of this trial, Linda Becker, they are ready to start with the first vaccination tomorrow, Wednesday, around about noon, given that the vaccines have reached their sites, of course.
And how many doses of the vaccine?
So we got 80,000 doses now. Now, the one big advantage of Johnson & Johnson is from the COVID vaccines that we have available at the moment, it's the only vaccine that only requires 1 shot. All the others require you to give 2 shots a few weeks apart. And the big advantage of that is that health workers don't have to spend time and resources to make sure that people return for their second doses. Otherwise, the vaccine wouldn't be effective. So in the case of Johnson & Johnson, administering the vaccine is easier because it only requires 1 dose.
Well, thank you so much for a comprehensive rundown of what the Johnson & Johnson vaccine, how that's going to be rolled out, as well as all the tests that still need to take place over a 2 to 3 month period. Thank you so much for your time.